This is the second part of the spinal cord and tracts lecture, and here I'm going to describe the various tracts in detail. Now, what you must realize is that there are a lot more tracts than I am going to describe, but I'm only going to be talking about the important ones and the ones that you will see when you go to the clinics. When you see a problem, most often it will be with these tracts that I'm going to describe. Now, in this image, what I want you to notice is, if you remember, I told you that in the white matter of the spinal cord, the posterior funiculus had only sensory tracts or ascending tracts. The lateral funiculus had both sensory and motor, as did the anterior funiculus. So if you look at this, you can see that all the blue areas marked blue are ascending tracts, and all the areas marked kind of reddish are descending tracts. So notice in the posterior funiculus, you only have this blue area. And if you remember, we had seen that the blue area was fasciculus gracilis and fasciculus cuneatus, which we called together as the dorsal or the posterior columns. So these were also known as dorsal columns. In the lateral and the ventral funiculus, notice that you have a combination on both sides of ascending or sensory tracts and descending tracts. So here again you have ascending and you have descending. And again, look at the symmetry on both sides. So these tracts are present on both sides and they are exactly similar. Now let's start describing these tracts in detail. And the first tract that we are going to describe are those dorsal columns. And these dorsal columns, if you look at your notes, I call it the dorsal column medial lemniscal pathway. It's called the dorsal column medial lemniscal pathway. The reason is that in the spinal cord, we call it the dorsal columns, but as it is moving up and it goes into the brain stem, it changes its name and then we call it the medial lemniscus. So that's why when we talk of dorsal columns or when we talk about the medial lemniscus, we are referring to the same tract. Now, this tract is responsible for carrying proprioception. And if you remember, proprioception was a muscle and joint sense. So it carries conscious proprioception. That means it reaches your conscious level. It carries a discriminative touch. So it carries conscious proprioception. It carries a discriminative touch. So I'm going to just write it as this. So discriminative touch, which is that 2-point discrimination, which we tested by, either using a divider and getting the points closer together, or an easier way would be to keep the patient's eyes closed and then draw something on their hand. So that is discriminative touch, and it carries stereognosis, very, very important. If you remember, stereognosis was the ability to describe the texture and the shape of a familiar object with your eyes closed. And of course, it carries this vibration sense. So all these kind of sensations are carried by the dorsal columns. So when you're doing any tract, you must know, and when you're doing a sensory tract, you must know what kind of sensations are carried by that tract, because obviously if that tract is damaged, then you lose these sensations. So this is what is carried by this dorsal column medial lemniscal pathway. And what all of these sensations do is, one, the sensations are finally carried to the brain. So you can see they finally go to the brain, and that area of the brain is known as the sensory cortex. So right here itself, it's a good idea to start getting familiar with these terms and which areas of the brain these functional areas are present in. So the sensory cortex is present in the parietal lobe of the brain, the parietal lobe of the cerebral hemisphere. So it finally goes to the sensory cortex, and it provides this part of the cerebral hemisphere with an picture of the body image, and one is aware of where your body is at rest, or even during movement, which is your muscle or joint sense. You know that if you're just standing with your arms by the side of your body, you know that your hand is resting by the side of your body, or if you flex one elbow, then you know that that is where your elbow is in space. So this is very, very important. So disturbance of this tract or disturbance of the parietal lobe of the brain will affect how the person perceives their body image and their sense of position. Now, how this tract um, how this tract is formed, let's look at that. So for this, I'm going to draw a picture here so that you understand how these various parts are represented. So let's say that this is the spinal cord, and let me just do this over. So let's say this is the spinal cord, and then this spinal cord is continuous with the brain through the foramen magnum. So here is the foramen magnum, and here it becomes continuous, and this part of the brain that it's continuous is known as the brain stem, and the first part of the brain stem is the medulla. Then there's the pons, and then that's the midbrain. So this part is called the medulla. Now, let's say we have one half of the body represented here. So I'm going to show you one half of the body. So this is the right side. So this is the right half of the body, and this is the left side. Now, here, of course, is the spinal cord. And if you remember in the spinal cord, so I'm going to take some anatomical liberties and try and show you here. This is the gray matter that we see here. This is the central canal. I mean, obviously, you can't see it this way, but I'm showing it to you here. So now fibers begin. So let's say all this area of the body is going to send fibers in relation to stereognosis or discriminative touch or conscious proprioception or vibration. So the fibers begin. So let's say they are beginning here in the lower limb. So they begin here. So they are passing into the spinal cord. As they do that, they have their cell body. So this is the first neuron. Remember, you always had 3 neurons. So the first neuron is in the dorsal root ganglion. These fibers go in. They enter the spinal cord. They enter the gray matter. But what happens is that they don't synapse here in the gray matter of the spinal cord. Instead, they just kind of pass out this way and keep going up. So this is going up. And let's say that this is the midline of the spinal cord. So what I want you to understand is, can you see the fibers from the feet are going to be medial most? Now let's say you take from the ankle area. Same thing, fibers begin from receptors here, cell body in the dorsal root ganglion. They enter and then they just pass up. So see, it's stacking up next to this. From the lower half, so you'll keep seeing there'll be more and more fibers. So let's say from the lower half of the trunk, same thing, comes here and stacks up here. And then they go up. So can you see that in this part, so if I was to say that this is the lower half of the spinal cord, so over here, if I was to draw, I would say that the feet are present here, and then this is the trunk. So can you see that? So this is how the body was being represented. Now let's look as the upper half starts sending in fibers. So again, from the trunk, upper half of the trunk, now this stacks up here. From the arm, hasn't relayed, comes and stacks up here. So now if we were to draw the body here, so you can say the feet ones are continuing, and now the arms and the lower part of the trunk is being represented. So this is how the body is. And just to complete it, I'm going to draw the face. So if I show it to you for this side, you can see that this is how it's going to be represented, with the head and neck not being seen in the spinal cord. Now these fibers, you can see they are still the first order neurons. These ones, this tract which is formed here, which represents the lower limbs and the lower half of the trunk, this collection of neurons is known as fasciculus gracilis. And then this collection of neurons, which is for the upper limb and the upper part of the thoracic region, is known as fasciculus cuneatus, which you see over here. So this is how they go up in this way. So if you were to take a section at this part of the spinal cord, and you take a section at that part of the spinal cord, and you show the spinal cord like this with the gray matter in this fashion and the central canal. So can you see that on this side you will see two tracts? So you'll see two tracts, this one and this one, because now you've cut a section, so all the axons present here will just be cut sections of the axons. This medial one you'll call fasciculus gracilis, the lateral one you'll call fasciculus cuneatus. The same thing will happen on this left side. So again, what you notice is fasciculus gracilis is medial, fasciculus cuneatus is lateral. So I hope that is clear. So now let me just take any one of these fibers. So let me take one from the lower limb. So it is going all the way up. It has traveled in the spinal cord. It's traveling now all the way up through the different parts of the spinal cord, and it goes into the medulla. Now once it comes to the medulla, in the region of the medulla, it actually goes and synapses on cells present in the medulla, in the gray matter of the medulla, and those cells are known, or those cells together form what is known as the gracile nucleus. So it has come and synapsed here. And now a second order neuron will begin from here. So this is for the lower limb and the lower trunk fibers. So all of these will do the same thing. The upper limb and the upper trunk fibers, they also go up. And as they're going up, what they do is they go and synapse on another nucleus which lies close by, which is known as the cuneate nucleus. So now the second order neurons will begin from here. And remember, if you remember when I did just the sensory tracts and I was giving you an idea, we had some things which were very important. One, it was a 3 neuronal pathway. Second, it had to cross, and so you had to know where the first, second and third neurons began. Third, it went and relayed somewhere, so there was a relay somewhere, and then from there it went to the brain. So let's look, we have to first look at the 3 neuronal part, and then we have to cross it. So right now we've only reached the second neuron. So this is the second neuron, which is in the gracile and cuneate nucleus. Now these fibers from the gracile and cuneate nucleus, so again you'll see many of them synapsing, they cross over in the medulla. So you can see that they are crossing over in the medulla. This crossing over, the term given to crossing over is known as decussation. So the term given is decussation. And this crossing is because these are sensory fibers, sometimes we call it sensory decussation. Now once they cross over and they are traveling on the opposite side, now they form a tract all together. So you don't have like a separate one for the upper limb and a separate one for the lower limb. They all kind of join together, and this tract which is formed here is known as the medial lemniscus. So this tract is called the medial lemniscus. So that's why we call it, all the way here, it was known as dorsal columns in the spinal cord. It goes into the medulla and then goes and forms the medial lemniscus. Now let's see what happens from here on. So what I'm going to do is, let me create another page and then follow this tract up. So here we have the brainstem, and then this becomes the cerebral hemisphere, and this is the midline. So this part here is the medulla, the pons, the midbrain, and this is the cerebral hemisphere. So we saw how these fibers were traveling up in the spinal cord. So this is, let's say, the lower limb fiber with its cells in the dorsal horn. It was traveling up, it came up into the medulla, and let's say the upper limb fibers again traveled up in the spinal cord and came into the medulla. Now in the medulla, these fibers synapsed, the lower part of the body and the gracile nucleus, the upper part and the cuneate nucleus. Now here the second order neurons started, and these second order neurons crossed over, forming the medial lemniscus. So they crossed over, forming the medial lemniscus. So this here is the medial lemniscus. So this tract now travels all the way up. And remember, we had to reach a third order. So this goes and synapses in an area or island of gray matter, which is known as the thalamus. And in the thalamus, this thalamus is subdivided into many different parts. So, you have many different parts of the thalamus. So this goes and synapses in a part called the ventro-posterolateral nucleus of the thalamus. So it synapses here, this medial lemniscal fibers, and the third order neurons begin in the ventro-posterolateral nucleus of the thalamus. From here, they pass out and go to the sensory cortex of the brain, which is in the parietal lobe. So this is the parietal lobe. So you'll have many fibers which are starting, and they all go out like this to the parietal lobe. This area which they are passing through, this area in the cerebral hemisphere is known as the internal capsule. Now, all this while we were only representing the body below the neck region. So we kind of didn't have the head and neck area. So what happens is that the head area is supplied by the cranial nerves, and the fifth cranial nerve, or the trigeminal, is responsible for most of the sensory supply of the head region. So what happens is that in the entire brain stem, from the fifth cranial nerve, so we'll do that later when we do the brain stem. So in this whole area, there's actually a nucleus for the fifth cranial nerve. So fibers from the head area pass through, they have a ganglion of the fifth, they come here and they synapse on these nuclei of the fifth cranial nerve. This is equivalent to the gracile and the cuneate nucleus. From here, fibers start and they join this medial lemniscal pathway. So this part here is known, this area here is known as the trigeminal lemniscus. So for now, I just want you to understand how the trigeminal lemniscus is joining this medial lemniscal pathway. It only joins it in the brainstem, and we'll be doing it when we do the brainstem. So this then travels with it, and then it goes and actually synapses not in the ventro-posteromedial nucleus, not in the ventro-posterolateral nucleus, it actually goes to the ventro-posteromedial nucleus of the thalamus. And then from there, the third order neuron will pass through with this in the internal capsule and go to the sensory cortex. So then the entire body kind of gets represented in the sensory cortex. So in your notes, when you see this trigeminal lemniscus, you must understand how it is formed and where it is formed and what is the purpose of the trigeminal lemniscus. So let's now go back and look at the slide in the PowerPoint so you understand this better. So this slide is really showing you the same thing that I drew for you in the other on the other page. So let's look at this one here. So you can see from the lower limb, so these are fibers, first order neuron in the dorsal root ganglion. So you can see how they are just passing through up here and forming the fasciculus gracilis. From the upper limbs, the first order neuron again in the dorsal root ganglion forming the fasciculus cuneatus. So they go all the way up. This part here is the medulla. So just so you know that this is the medulla. In the medulla, the fasciculus gracilis synapses on the nucleus gracilis, the fasciculus cuneatus synapses on the nucleus cuneatus. They now, the second order neurons cross over and notice they form the medial lemniscus. So the medial lemniscus travels through the medulla, through the pons and through the midbrain. So again, these three structures, the midbrain, pons and the medulla form what is called the brain stem. That now goes and all this medial lemniscus now goes and synapses in the thalamus. Now in the thalamus, these fibers, they synapse in what is called the ventroposterolateral nucleus of the thalamus. And here you can see that from the head and neck area, the fibers are coming through the fifth cranial nerve or the trigeminal nerve that synapses in the nucleus of the trigeminal nerve. The second order neurons join, form a tract which goes up, and this tract here is known as the trigeminal lemniscus. So you can see this tract here, the trigeminal lemniscus has joined the medial lemniscus, and the trigeminal lemniscus goes and synapses in the ventroposteromedial nucleus of the thalamus, whereas the medial lemniscus goes to the ventroposterolateral nucleus. From here, third order neurons pass out, and they pass out in this area here, which is called the internal capsule, and they go to the sensory area of the brain. So see how it is, you see it represented in the sensory area of the brain. So if you take a section of the spinal cord, you can see here gracile fasciculus and cuneate fasciculus. This is just showing you the whole thing in a linear fashion. So again, notice how the stacking up occurs. The lower limb fibers present medially, the upper limb fibers present laterally. And then up here, when you go here, you can see that you have the head area. So this part here is the head area. And then this goes up, and from here through the internal capsule all the way up to the parietal lobe. So make sure when you look at these images, you understand what is happening, and what you must know is what sensations are carried, where the three neurons lie, the three order neurons, where they lie, where the synapse takes place, which nucleus of the thalamus the second synapse occurs, and then, which lobe of the brain it goes to, so the parietal lobe. So this is how you're going to study when you do any tract. And in your resources or the links that I've given you, I have some really good review exercises that you can do. So make sure that you look at that and, you attempt those self-evaluation quizzes, and that will really help you with the rest of the, it'll help you with neuroanatomy. Now let's look at the second pathway, which is known as the spinothalamic tracts, and this is also called the anterolateral system. So the spinothalamic tracts are also known as the anterolateral system. Just as that was called the dorsal column medial lemniscal pathway, the spinothalamic tracts are also known as the anterolateral system. So here again, I'm going to draw it first for you. And let's choose a new page, and then we'll see how the spinothalamic tracts are formed. Now, I've shown you that there are two spinothalamic tracts. One is called the anterior spinothalamic tract, and there's another one which is called the lateral spinothalamic tract. So that's why actually it's called the anterolateral system, because one is anterior and one is present laterally in the white matter of the spinal cord. This anterior spinothalamic tract, some people believe that it is responsible for light, crude touch. You know, just that when you graze your skin and you can feel touch, so light, crude touch. Whereas the lateral spinothalamic tract is responsible for pain and temperature. And other people believe that these tracts are really joined together and they don't exist separately. So that's why they call it the anterolateral system. And this anterolateral system is responsible for touch, pain, and temperature. So, you know, either way, these are the sensations which are carried: crude touch, pain, and temperature. Now, this tract, this anterolateral system, what happens is as it travels in the brainstem, it changes its name into what is called the spinal lemniscus. And you will find that when you reach the brainstem, the names change. So, for example, the dorsal columns became the medial lemniscus. This anterolateral system becomes the spinal lemniscus. And then you remember the medial lemniscus was joined by the fibers from the face area, the head area, and that was called the trigeminal lemniscus. And later we'll see the auditory pathway. So the auditory pathway is called the lateral lemniscus. So when we look at the brainstem, you should not get confused when you see that the names now are different. So you must know what they correspond to. The medial lemniscus and the trigeminal lemniscus, the medial lemniscus corresponds to the dorsal column. The trigeminal lemniscus is from the head area but carrying the same kind of sensation. So this carries the proprioception and stereognosis and all of that. The spinal lemniscus is the same thing as the anterolateral system. So this carries touch, pain, and temperature. And then the lateral lemniscus is the auditory pathway, which we'll see later, but I'm just introducing it to you, and that is for hearing. So let me now show you how this anterolateral system is formed. So here again, let us draw the spinal cord. So here is the spinal cord, and then the brainstem. And let me start with this. So here the first order, so again we'll draw one half of the body. That's the head. So this is the right side of the body. So this is the right side of the body. So here let us see what happens. So again from the lower limb, so let's start with the fibers from the lower limb. So they begin in the lower limb. The first order neuron is in the dorsal root ganglion. These fibers come into the spinal cord and they actually travel up a little bit and then synapse in the posterior horn of the spinal cord. So this part where they travel up a little bit, so let's say you have some other fibers coming like this, and then traveling up a little bit before they synapse. This little part where they're traveling up, this area here is often called the dorsolateral tract of Lisor. So when you see it in your notes, just so that you don't get confused, this is what it is. So anyway, they travel just maybe a few segments in the spinal cord. They don't go exactly to the same segment. They travel up in the white matter of the spinal cord for maybe a couple of segments. And then they synapse in the dorsal horn of the spinal cord, and now the second order neuron begins here. So once again, let me divide this. So the second order neurons begin here. So this is from the lower limb. So they cross over and go to the opposite side, forming a tract in the anterolateral part of the white matter. So this is traveling all the way up here. Now here from the thoracic region, again, first order neuron in the in the dorsal root ganglion, synapses in the dorsal horn. The second order neuron begins in the dorsal horn, travels and joins this. From the upper limb, first order neuron again in the dorsal root ganglion. So you can see some common theme over here in that the first order neuron is always in the dorsal root ganglion. This comes synapses in the dorsal horn, and now the second order neuron begins and joins it. So can you see how this stacking is taking place? So as these travel up through the brainstem, this stacking is taking place in a manner in which the leg is represented laterally and the upper limbs are represented medially. So, you can see this tract which is formed in this fashion. The leg is represented laterally and the upper limbs are represented medially. Now, as they are passing through the brainstem, so this is passing through the brainstem. Here, the face area begins to send its impulses. So again, from the face, the impulses will pass through this synapses in a nucleus of the trigeminal. Again, we'll see that when we do that. And then the second order neurons come and join it here. There is no name given to these second set of fibers. Right now, let's not give it a name. So they just join it from the head and neck area, and all of this now passes together as a tract, which we will now call, since it's present in the brainstem, we call this tract the spinal lemniscus. So at this point, because it was, as you can see, in an anterolateral fashion, this is known as the anterolateral system. Or we can divide it, if you want, into a lateral portion being the lateral spinothalamic tract and the anterior portion as the anterior spinothalamic tract. But you can see they're joined together, so all of touch, pain and temperature goes in the anterolateral system. And then in the brainstem, this changes its name and it's known as the spinal lemniscus. Now let's see what happens when it goes further. So now let's say it's going further. So this is the spinal cord. Or let me just start with the brainstem. So here we had the brainstem and then the cerebral hemisphere. And let's say here was the thalamus and its various parts. So we had these fibers from the face which have joined. So we had these fibers from the face which joined this, and then of course we had all the previous fibers traveling up. So these were the fibers in the anterolateral system. So they come here and they synapse. The anterolateral part synapses in the VPL nucleus of the thalamus. Again, notice a common theme. That means from the body, the sensory fibers synapse in the VPL nucleus, whereas the part from the face goes to the ventroposteromedial nucleus of the thalamus. Now the third order neurons begin from here and they go to the parietal lobe of the brain, which again is the sensory cortex. So they go to the sensory cortex, which is the parietal lobe of the brain. So here you can see that the first order neurons will be present in the dorsal root ganglion. This is for the body. In the case of the face, the first order neuron is present in what is called the trigeminal ganglion. The trigeminal ganglion, which is similar to the dorsal root ganglion. That's the first. The second order neuron is in the dorsal horn of the spinal cord. So this is different from the medial lemniscal pathway where the second order neuron was in the gracile and cuneate nucleus. So there's a difference. And the third order neuron is in the VPL nucleus, or third order neuron begins in the VPL nucleus or the VPM for the face. So that, and they all go to the parietal, the final uh, termination is in the parietal lobe of the brain. So let's now look at the slide and see how this is. So here in the slide, notice that here from the lower part of the body, first order neuron in the dorsal root ganglion, synapses in the dorsal horn, and goes into the anterolateral part of the spinal cord. So you can see here, this is the anterolateral part of the spinal cord. From the upper limb, the same thing, synapses in the dorsal horn, crosses over and joins this anterolateral system. Now, one important thing that I want you to notice when this crossing over is taking place, notice how this crossing over is taking place in front of the central canal in this area of the white matter over here, which I had called the anterior commissure, and this is also known as the white commissure. So this crossing over takes place in the white commissure. And this is important because we will see it when we do a lesion called syringomyelia, how these fibers will get interrupted up here. Then you can see from the face part, the fibers come into, from the face, the first order neuron is in the trigeminal ganglion. And these fibers then come and synapse in a trigeminal nucleus. They join this anterolateral system. The part from the body goes to the VPL nucleus of the thalamus. The part from the face goes to the VPM nucleus of the thalamus. From there, it goes to the sensory area in the parietal lobe. So this is just showing you the longitudinal way that you can represent it. Notice the anterolateral pathway, and again, we'll draw it this way. And up here, we'll include the face. And that's how it goes into the sensory cortex of the brain. Now, this sensory cortex of the brain, in your notes, it's in the parietal lobe. It's also known as the post-central gyrus. So the sensory cortex of the brain is also called, the sensory part of the brain is also called the post-central gyrus. Just so that you don't get confused with so many terms, the sensory cortex is seen in the parietal lobe, and in the parietal lobe, the part where all of these finally go and relay, this part here, that's called the post-central gyrus. So now let's look at the next tract, or okay, before we look at the next tract, or actually it is here in this picture itself, I want to tell you about the spinoreticular tract. Now, this spinoreticular tract is one which is bilaterally distributed. That means that it doesn't go, the pathway doesn't go from the body, from the right side to the left side. Instead, you have it crosses over and goes to the other side, but it remains on the same side too. So, you know, that's what is meant by it's bilaterally represented. So it's both crossed and uncrossed. It accompanies the spinothalamic tract. So you can see that this is the anterolateral system, and so it's present close to it, the spinoreticular tract. This finally goes to the reticular formation. So that's why it's called the spinoreticular tract, from the spinal cord to the reticular formation. The reticular formation is distributed along the entire brain stem, and its main function is to keep the cerebral cortex informed of what is happening and keep a person in the alert state. It also goes to a part of the brain which is known as the limbic system, and the limbic system is distributed throughout the brain in different parts, and this has connections with the autonomic nervous system. And this has a lot to do with emotions and how emotions are connected to the sensory input that we receive. For example, if you look at something which is really horrific, you might start crying. Or for example, if you feel you get pinched really badly, or pain is really severe, how your emotions respond to that. So all of this connection is through this spinoreticular formation. So it all sensations are connected to the limbic system and the reticular formation. So you're kept alert, and at the same time you react to the different sensations which the body is subjected to. So that is the purpose of the spino-reticular tract. Now let's see how we use this knowledge of the tracts being somatotopically arranged for pain relief, because the anterolateral system was responsible for pain, temperature, and touch. So you can use this pain relief. You can relieve pain, and you do that by a process which is known as chordotomy. So this chordotomy is when the spinothalamic tract or the anterolateral system is interrupted on either one side or both sides, and this is done when somebody has what is known as intractable pain. That means they are getting no relief from any medication you give them. And pain is something that no patient should ever suffer from. So in this, there is a procedure which is known as percutaneous chordotomy. It means done through the skin. And in this, the patient is sedated and a needle is passed between C1 and C2 vertebra. So you can see a needle being passed between C1 and C2 vertebra. It's passed into the subarachnoid space. And under radiological guidance, a needle, you can see a needle being passed through, and it's advanced into the anterolateral part of the spinal cord. And then a stimulating electrode is passed through that needle. And this is, this pathway is then destroyed. So, the stimulating electrode destroys this pathway. Once this pathway is destroyed, then the patient is insensitive to pinprick or temperature, but it is to the opposite side, because if you remember, suppose you take the spinal cord this way, and here is a tract which is present, which is going all the way here. Remember, this tract, which is on this side, is carrying impulses which come from the opposite side of the body. So, these impulses are really this is on the left side, but these were really coming from the right side of the body. So if you destroy this tract up here, then the person on the right side of the body will not feel any pain or anything. So that's why, suppose this tract is destroyed, you'll not feel any pain, pinprick, depending on which level. Obviously, if you destroy it high up, which is what is done at the C1, C2 level, that means now the tract is carrying fibers from the entire body. So that's why this person has loss of pain, temperature, and touch on this side of the body. Now here in this image, this is slightly wrong, because you can see that this is really the right side, and they're showing you that the right side is, there's loss of pain and temperature. They should have, and it's probably because the head is turned awkwardly or something. So remember, this is you're destroying the left side of the body in order to get loss of pain, temperature, and touch on the right side of the body. And now the effect commences several segments below, because, remember I told you that these fibers cross over. Remember, they went up a little bit, and then they crossed over. So if you destroy it at C1 and C2, the effect is present below maybe C3. And that's because of the way this crossing occurs. This procedure is sometimes done for patients who are terminally ill with cancer, but you never do it for benign conditions as a pain relieving effect, because it wears off after a year, because there are some uncrossed spinoreticular fibers, and they sort of still respond to pain. Now let's look at the spinocerebellar fibers, and here again I want you to understand the spinocerebellar fibers. So in spinocerebellar fibers, what happens is that if this is the spinal cord, and let's say this is the brain stem, and let's draw the cerebellum up here. So this is the cerebellum. This is different from the ones that we have discussed, in one that it is a 2-neuronal pathway. It is an uncrossed pathway for most most of them. So for most of them, it is uncrossed. So in other words, it's ipsilateral. And this is unconscious proprioception. That means you are not aware of it. So this is unconscious proprioception. Now there are 4 tracts which are basically formed. One is called the dorsal or posterior spinocerebellar pathway. Then there's one which is cuneo-cerebellar pathway. There's another one which is called anterior or ventral spinocerebellar. So we'll call it the anterior spinocerebellar. And then one there's which is called the rostral spinocerebellar. We'll mainly be concerned with these two, and I'll also discuss this a little bit. Now, these two, the posterior spinocerebellar and the cuneo-cerebellar, these are concerned with unconscious proprioception, and they are the ones which tell the cerebellum of the state of tension of the muscles or the tendons or the joints, whether the joints are acting properly, and they give the cerebellum all this information. These other two, the anterior spinocerebellar and the rostral spinocerebellar, they are responsible for determining the spinal reflex activity, and then they pass on that to the cerebellum. Now, the posterior spinocerebellar carries fibers from the lower limb and the lower part of the body, and the cuneo-cerebellar carries from the upper limb and the upper part of the body. And the impulses all come from the muscles and joints, the muscle spindles and the receptors inside this, and they give the cerebellum this information so that the cerebellum can coordinate the movement and maintain posture. So let's see how these tracts are formed. The cuneo-cerebellar is formed in the brainstem. The spinocerebellar is formed in the spinal cord. So first let's look at the spinocerebellar, the posterior spinocerebellar. So again, you have 2 sets of neurons. So if I was to draw the body in this fashion. So from here, the fibers begin. They are very large. They're extremely large fibers. Their first order neuron again in the dorsal root ganglion. The first order neuron is in the dorsal root ganglion. And then this goes into the spinal cord, and it synapses in the spinal cord in a set of neurons which are known as nucleus dorsalis. So this is called nucleus dorsalis. The second order neurons begin here, and then they travel on the same side. So let's draw this way. They travel on the same side, forming a tract on the posterior aspect of the spinal cord, and then they go to the cerebellum on the same side. So you can see there is one neuron here, and the second order neuron starts in the nucleus dorsalis, just 2 neurons. It is also uncrossed or ipsilateral. It's going to the cerebellum of the same side, and it is carrying unconscious proprioception. The cuneo-cerebellar fibers, which is from the upper limb, they really basically travel up initially, go and synapse in an accessory cuneate nucleus, which is present in the medulla. If you remember, the cuneate nucleus was present in the medulla. This is an accessory cuneate nucleus. The second order neurons go on to the same side, cerebellum. Now, this anterior spinocerebellar fibers, these are a little different because they are crossed fibers. So what happens with the anterior spinocerebellar fibers is that they come from the lower limb. They have their dorsal root ganglion, the first order neuron in the dorsal root ganglion. They come into the spinal cord. They synapse here. The second order neurons begin here. You don't have to remember where they synapse. So we'll just say they synapse in the dorsal horn of the spinal cord. They cross over to the other side, and they travel in the anterior funiculus of the spinal cord, and that's why they're called the anterior spinocerebellar. Now they're crossing over, but what happens is that in the brainstem, in one part of the brainstem, that's the midbrain, they recross and then they go into the cerebellum of the same site. So you can see they are still two neuronal. They are not crossed, but they still go to the ipsilateral cerebellum. So they still sort of hold good for the, the way the cerebellar fibers are supposed to be. The rostral spinocerebellar begins for the upper limb and the head and neck area. It has its first order neuron here. I should have shown the first order neuron here for this one too. So it has its first order neuron, its synapses, and instead of crossing over like this one, it just goes on the same side. So the only one which is crossed at the level of the spinal cord and most of the brainstem is this anterior spinocerebellar, but then it recrosses and goes back to the same side. So now let's look at what I'm trying to show in the PowerPoint slide. So here in the PowerPoint slide, you can see that I've said it's two neuronal, mainly uncrossed. Its termination is in the cerebellum and it's unconscious proprioception. So let's look at how the posterior spinocerebellar one is formed. So the fibers begin in the lower limb, their cell body in the dorsal root ganglion, the first order in the dorsal root ganglion. It comes here and synapses at this point, and that this area here is the nucleus dorsalis, or also called dorsal nucleus. The second order neurons begin here, they pass out and they travel in this posterior spinocerebellar. So no crossing takes place. From the upper limb, the same thing will happen, but here it will form the rostral spinocerebellar tract. So you can see how the two of them are traveling together, and they'll go all the way up to the cerebellum of the same side. In the case of the anterior spinocerebellar, the fibers begin on the other side of the body. They come in, synapse in the, the base of the posterior horn. The second order neurons cross over to the other side, as you can see, and they form the anterior spinocerebellar, which, as I showed you, they recross before they enter the cerebellum. So this is how the spinocerebellar fibers are formed. And higher up you would see the cuneocerebellar, but this is the spinal cord, so you're not seeing that. Now, if you look at this image here, I want you to look at this very, very carefully. Even though I've labeled spinocerebellar, you're seeing all the other tracts that we have studied so far, and you should know whether they are crossed or uncrossed at this level. So you can see this gracile fasciculus, this one, which is from the lower limb. It's an uncrossed tract. So you can see it's uncrossed at this level, because remember, the fibers came in and in the spinal cord, they were not crossing, they crossed in the medulla. This is the fasciculus cuneatus, again uncrossed. So the dorsal columns in the spinal cord are uncrossed. So you have to understand this. The posterior spinocerebellar, again, as I said, uncrossed. We just described and showed it. The rostral spinocerebellar, again uncrossed. The anterior spinocerebellar is crossed because we've just shown the crossing. This part here, which is the anterolateral column and which has been divided into lateral spinothalamic and anterior spinothalamic tract. So this tract which is formed, this tract is formed after the fibers have come in, synapsed in the posterior horn, and now the second order neurons are the ones which are forming this tract. So you can see that this tract here is a cross tract. So the lateral spinothalamic and the anterior spinothalamic, which form the anterolateral system, you can see is a crossed tract. And then the spinoreticular, remember I told you that the spinoreticular it is both crossed and uncrossed. So then, that's why it is kind of partly crossed at this level. So this is very important for you to understand at this point. And another thing you should understand at this point, this gracile fasciculus and cuneate fasciculus, they are carrying the first order neurons because they have not synapsed yet. So this is still carrying the axons of the first order neurons. The posterior spinocerebellar and cuneocerebellar, they are carrying the fibers of their second order neurons. In any case, these have only two neurons. The The anterolateral system, these are carrying the second order neuron fibers. That's how the tract is formed. And the anterior spinocerebellar is again carrying the second order neurons, again for the cerebellum. So, again, you must know, you should be able to tell if you're given this dorsal column, one, that it is ipsilateral at this point, it is of, no crossing has occurred, and it's still carrying the first order neurons because the second order neurons begin in the medulla. So very important for you to know this. Now let's go on to descending fibers. And again, for descending fibers, I'd first like to explain this to you. So let's use a different page. Now, descending fibers, we don't typically describe it as a neuronal first order, second order or something. Instead, we call it upper motor neuron and lower motor neuron. The upper motor neuron we can think of as the first order, that means it begins from there, and the lower motor neuron as the second order, but I don't want you to think of it as first or second order. Just think as upper motor neuron and lower motor neuron. When we say upper motor neuron, that means it is the point of origination. When we say lower motor neuron, it means that where this point of origination fiber, where this synapsed. So the lower motor neuron is where the first synapse occurs and the final pathway begins. So what I'm trying to say, so let's say that if this is the cerebral hemisphere and let's say this part is the spinal cord. So if we say a neuron begins here and comes all the way down and then synapses here, this neuron will be called the upper motor neuron. This one where it's synapsed, and from here now it exits out of the spinal cord. This one is going to be called the lower motor neuron. If the fiber comes from here and synapses somewhere here, and now a fiber begins here and gets out here, this will still be called the upper motor neuron. This will now be called the lower motor neuron, even though it's present a little higher up compared to this. So this final pathway is called the lower motor neuron. So let's look at the descending tracts. These descending fibers, these are one thing that you had to remember is these are motor fibers. Earlier on when we were discussing the sensory fibers, these were ascending tracts. These now are motor and they are called descending tracts. They come from either their upper motor neurons, or their point of origination is either from the cerebral cortex or any part of the brainstem. They usually cross, so they usually decussate. Because remember, the body is, the cerebral hemisphere controls the opposite side of the body. It was the cerebellum which controlled the same side, so that's why they have to decussate. Their final pathway, so the second or the lower motor neurons, the final pathway is either from the anterior horn cells. If you remember, I had told you the anterior horn cells of the spinal cord gave rise to motor fibers or efferent fibers. So they are either the anterior horn cells or they are from the cranial nerve nuclei. So the cranial nerve nuclei. And if we just go up, if you see up here, as I've tried to show you, so you can see these lower motor neurons are from the anterior horn cells and these are the cranial nerve nuclei. So the second neuron, or are known as the neuron of exit, is the anterior horn cells of the spinal cord or the cranial nerve nuclei. And these lower motor neurons, their activity is modulated by other neurons. And if you remember, when we did earlier on, I showed you how the anterior horn cell had all these fibers which came and synapsed, and in fact this has that Renshaw cell which went back and synapsed on it. So that's why this activity is modulated by all these other input from everywhere in the brain, And this Renshaw's, if you remember, I told you, had a negative or a braking effect. That means it kept it in check. It had a braking effect on it. So let's look now at these descending pathways and see what they are called. So the main descending pathways that we are concerned with are, it's called the corticospinal tract. This corticospinal tract is divided into something called the lateral corticospinal tract and one which is called the anterior corticospinal tract. Just so it's given these two names just because this is the area. It's present in the lateral part of the spinal cord, and this is present in the anterior part of the white matter of the spinal cord. So they are together, they are the corticospinal tract. As this corticospinal tract passes through the medulla, it passes through a region of the medulla which is known as the pyramid. So that's why these corticospinal fibers are also sometimes called pyramidal fibers. And these corticospinal tracts, here you can see it's going from cortex to the spinal cord. But some of these fibers which began in the brain, and just so that you remember this, you can see here some of these fibers which began in the cerebral cortex, they went up and ended higher up. They didn't go to the spinal cord, but they ended in the region of the brain stem. And where in the brain stem? They are going to the cranial nerve nuclei of the brain stem. These cranial nerve nuclei are similar to the anterior horn cells. So those fibers from the cerebral cortex, here again I showed you, they're going from the cerebral cortex and they go to the cranial nerve nuclei. So here, those fibers which are going from the cortex to the cranial nerve nuclei, instead of being called corticospinal fibers, we give it another name. We call them corticonuclear fibers, or also known as corticobulbar fibers, because the brainstem used to be called the bulb. It's corticobulbar fibers. Now let's see how these fibers are formed and what happens. So let's say here we have the cerebral cortex, or let me just do it differently. So here we have the cerebral cortex of this side, cerebral cortex of this other side. This is the brain stem, and then the spinal cord. Now right here, before I go any further, I want you to understand that if you remember in the spinal cord, so we had the spinal cord, and this was the spinal cord, the gray matter and the central canal, and this was called the anterior horn of the spinal cord, and it gave rise to efferent fibers or motor fibers which came out, and remember they went through the ventral root into the spinal nerve, and then they passed out through the rami. So they contribute to the motor fibers in the spinal nerve, right? So these anterior horn cells contribute to motor fibers in the spinal nerve, and they are destined for the skeletal muscle of the body. Now in the brain stem, so let's say here in the brain stem, this brain stem supplies the head and neck area. So if you were to represent the body like this again up here, so this part of the body is supplied by spinal nerves. So all the spinal nerves come out. So all the muscles in the body are supplied by the anterior horn cells which is present in the spinal cord. But this head and neck area, this is supplied by cranial nerves. The cranial nerves are present higher up inside the skull. Now they cannot come from the spinal cord, so they have to come from a part of the brain. And they are coming from a part of the brain which is the brain stem. So which are the cells which give rise to the motor fibers in the cranial nerves? Those cells which give rise to motor fibers in the cranial nerves belong to the cranial nerve nuclei. So I'm just going to draw the cranial nerve nuclei like this. So these cranial nerve nuclei, in other words, the cells in the cranial nerve nuclei, are similar to these anterior horn cells. So this concept you must understand. So the cells in the cranial nerve nuclei, so let's say the cranial nerve nuclei is just a collection of cells. So here we called it the anterior horn. So instead of calling it the anterior horn, I'm just calling it the cranial nerve nuclei. It has cells in it, and these cells give rise to the different fibers present in the various cranial nerves. So you'll have fibers present, for example, in the third nerve. You'll have fibers present in the seventh nerve. You'll have fibers present in the ninth nerve. You'll have fibers present in the 10th, and so on. And they will go to supply the different regions of the face and the head and neck area. For example, the third will supply the muscles of the eye. The seventh will supply the muscles of facial expression, and so on. So these are the cranial nerve nuclei. And these are the anterior horn cells. So now let's see how the passage of fibers happens. So from the cerebral cortex, and most of the fibers begin in an area of the cerebral cortex which is known as the motor cortex, or also called the precentral gyrus. So most of the fibers begin here. Other fibers begin in what are known as supplemental motor areas. Some fibers begin from that sensory cortex, and different parts of the parietal lobe. One area is called the superior parietal lobule. But most of it begins from here. So fibers begin from here. So the cells begin from here. So let's draw cells up here in the gray matter of all of these. So these cells travel down this way. So this is the upper motor neuron. So they pass from here. They're traveling. And so since they are going from the cortex, most of them go down to the spinal cord. We'll call this the corticospinal fibers. And as they pass in the medulla, they will travel in a region of the medulla which is called the pyramid. So they, often we call them pyramidal fibers for that reason. So they're traveling down this way. And then what happens is, in the medulla, these fibers, most of them, they cross over. So most of these fibers cross over, about 80%, and 20% remain on the same side. So once they cross over in the medulla, they are now going to lie in the spinal cord. So where they lie in the spinal cord, this is now called the lateral corticospinal tract. This uncrossed part, which is here, this is known as the anterior. This is called the anterior corticospinal tract. So this, you can see that crossing has occurred. 80%, 20% haven't crossed. So here I'm going to take another page and just show again. So this is the cerebral hemisphere, the brainstem, the spinal cord. Cerebral hemisphere, brainstem, spinal cord. So let's take, I'm just going to take like one fiber, began here, traveled, and this is the midline. It traveled, it crossed over, came on this side, and some remained on this side. Most of it crossed over. So this is the lateral corticospinal tract. This is the anterior corticospinal tract. These which have crossed over, they now come and synapse on the anterior horn cells. And here now the anterior horn cells exit the spinal cord and they go to supply the skeletal muscle of the body. So here, if I was to show you, this is the of this side, and I complete the face and the legs of this side. So you can see that this is the right cerebral hemisphere. It is passing its fibers out, comes to the anterior horn cells on the left side of the spinal cord, and the anterior horn cells of the left side are now going to the leg or the left leg. So you can see that the right cerebral hemisphere is controlling the left side of the body. So you can see that the control is contralateral. What happens to this 20% which is uncrossed? Here, this anterior corticospinal fibers, of these, 10% of the fibers, they cross at the local level. So 10% of the fibers cross over at the local level. So instead of crossing higher up, they have crossed here, and so they influence the anterior horn cells of the opposite side. And then these again go to supply the body on the other side. So you can see it's still the right side is controlling the left side. Only 10% remain on the same side, and they influence cells on the same side of the body. So you can see that only 10% are influencing it on the same side. And this kind of explains sometimes when one loses, one has a stroke and they are paralyzed, when recovery occurs, how does it occur? It's because of this 10% which has remained uncrossed. So this is how the cerebral cortex is going to influence the anterior horn cells of the opposite side. And this is therefore going to influence the anterior horn cells, which are the cells of the spine, which give rise to spinal nerves. What happens to cranial nerves? So here, these fibers which are traveling, they come here. They now go over in the brainstem. So in the brainstem, you had these cranial nerve nuclei. So these were anterior horn cells. So let me draw some cranial nerve nuclei. So these fibers come, they go and synapse on the cranial nerve nuclei. And this now, so the crossing over occurs at whichever point it has to go through. So cranial nerve nuclei. So the third, for example, is present in the midbrain. The seventh is present in the pons. The ninth and 10th are present in the medulla. So you can see the crossing over occurs at all levels of the brainstem. Now the second neuron, or what is the lower motor neuron, begins here. And if it's the third, it will go to supply the muscles of the eye of the left side. If it's the face is a little different. So, I'm not going to mention too much about the face. It's a little complicated. But let's say it's the 10th or the 9th. So it goes to supply the muscles of the pharynx and larynx of the left side. So you can see that it's very similar up here. So the lower motor neurons in the spinal cord are the anterior horn cells. The lower motor neurons in the brainstem are the neurons of the cranial nerve nuclei. So having understood this concept, let us now look at at these tracts. So this is what it's showing you, the upper motor neurons. So you can see that they are beginning, most of them begin in the motor cortex. So this is showing you the left motor cortex. They have other fibers which begin in the supplementary motor area, in the sensory cortex, which is the parietal lobe, and this part is called the superior parietal lobule. They are traveling down, and as they are traveling down, they too travel through this part here, which is known as the internal capsule. If you remember, I told you that the ascending fibers were going through the internal capsule. So this internal capsule, you can see at this point, is carrying both descending and ascending fibers. And this part here, you can see they kind of get so close together. They travel down the brainstem. And as they are traveling down the brainstem, as you can see here, they're lying in the pyramid, which is part of the medulla. And in the pyramid, 80% cross over, 20% remain on the same side, as you can see. Of those 20%, 10 will cross at the local level, which you can see here, whereas 10 remain on the same side. So the ones which cross over form the lateral corticospinal tract. This together forms the anterior corticospinal tract, and this is the 10%, which is the uncrossed part, and you can say the uncrossed part of the lateral corticospinal tract. Now here we are looking at the corticospinal tract as it's coming through. So notice how the upper motor neurons, they are beginning up here in the cortex. Some fibers, some upper motor neurons may begin in the brainstem also. So let me just go back up here. So just to show you, some upper motor neurons actually may begin in the brainstem. So they may start up here, and they are from different nuclei in the brainstem. So some are known as a red nucleus, cerebrospinal. Some may come from a vestibular nucleus. It will be called vestibular spinal. So they've got different names. They do not form part of the corticospinal. Their names will depend on where they're coming from. So here we have these fibers, these upper motor neurons from the cortex, from the motor cortex or the supplementary and so on. So they're traveling down, they pass through this internal capsule. As they travel down, they are passing through the brainstem. So you can see they pass through the midbrain. They are present in the anterior or the ventral aspect of the midbrain. Then they pass through the pons. And so again, they are passing in the ventral aspect of the pons. And then they pass through the medulla where they lie in the pyramid. So as you can see, they are coming down. Notice how some fibers are peeling off and going to the cranial nerve nuclei. So these are what we call the corticonuclear fibers. So notice how they peel off at different levels. And then from the cranial nerve nuclei, the second or lower motor neuron will start and go to supply the skeletal muscle that it's destined for. So those are the corticonuclear fibers. These, which we'll continue with, these are the corticospinal fibers at the level of the medulla. Notice they are crossing over, and there they form the lateral corticospinal fibers. Those that don't cross form the anterior corticospinal fibers, and then the anterior corticospinal fibers will cross over at the same side. Now this looks like the anterior is crossing, but the anterior is of the same side. So this picture is slightly wrong up here. So this is how the corticospinal fibers are formed. So when you look at the spinal cord, you'll notice the lateral corticospinal present in the lateral funiculus. That's why it's called the lateral corticospinal. And the anterior corticospinal is present in the anterior funiculus. That's why it's called the anterior corticospinal fiber. And here, this is showing you the anterior horn cell. And this is a picture you've seen earlier, and it's supplied to the muscle. So its influence is through the corticospinal, which is the upper motor neuron. And it is also influenced by other fibers which begin in the brainstem. For example, from the reticular formation, or the red nucleus, where it will be called the rubrospinal, or these other nuclei present in the brainstem. So they are given different names. So all of these exert a sort of braking effect on these anterior horn cells, which are also called alpha motor neurons. And then we also have this Renshaw cell. So they all effect a negative feedback on the anterior horn cells, kind of keeping them in check. In tetanus and in strychnine poisoning, the effects are very similar to tetanus. Strychnine is a very potent glycine receptor blocker. So it blocks the receptors which secrete glycine, and Renshaw cell, the neurotransmitter is glycine. So these affect these Renshaw cells. So if the Renshaw cell is knocked off, obviously the anterior horn cells, now it comes out of that negative effect, and the victim suffers agonizing convulsions because these alpha motor neurons are liberated from that inhibitory effect. And now these Renshaw cells are abundant in the face area, in the trigeminal nucleus, and in the cervical segments of the spinal cord, which is why jaw muscles and facial nerve muscles, the convulsions are seen in these two groups. So that's what you see in tetanus and in strychnine poisoning. Let's move on to the next slide. These are the other descending tracts that you see in the spinal cord, and these other descending tracts are the autonomic tracts, because remember, you had the autonomic nervous system too, and that also has an upper motor neuron and a lower motor neuron. The lower motor neuron for the sympathetic nervous system was present in the lateral horn of the thoracolumbar segments. The lower motor neurons for the parasympathetic nervous system is present in the cranial part, connected to some cranial nerve nuclei, and in the sacral 2 to 4 segments of the spinal cord. So this is the lower motor for this. But where does the upper motor come from? The upper motor comes from the hypothalamus. So the upper motor comes from the hypothalamus. and from other areas in the brainstem. They come down and then they terminate in the lateral horn of the spinal cord, or in the case of the sympathetic for the thoracolumbar region, and they terminate in the sacral segments of the spinal cord, or they come and terminate in those cranial nerve nuclei. And these are responsible for normal autonomic activity, and you will see these descending autonomic pathways present within the spinal cord. So this is showing you the central autonomic pathway. And in this picture, you can see that this is the lateral corticospinal, and here you can see the anterior corticospinal. You see numerous other descending pathways, but I don't want you to remember these names because, it just confuses the issue. But notice how they're coming from the pons, they're coming from the vestibular nucleus, from the tectal nucleus. All these are present in the brainstem. So this is important. These are the ones that are colored or sort of labeled. Those are the ones that are important for you. Now, some of these descending autonomic pathways, they come in the cervical region or the upper thoracic region. They come to a point which is known as the ciliospinal center. And this is important because this is concerned with pupillary reflexes. And this interruption in the upper cervicothoracic region, if this is interrupted, it results in a syndrome which you'll hear of very often, which is known as the Horner syndrome. And this is a sympathetic affectation because this affects the sympathetic nervous system. This person has ptosis, which is drooping of the eyelid, and there is constriction of the pupil because the sympathetic nervous system causes dilatation. Here there is constriction, and that is known as miosis. So now this finishes this part of the presentation. So this entire spinal cord and tracts is done. So once again, I would ask you to look at the presentation more than once, thoroughly understand it, try and draw this for yourself, always know where crossing occurs, how the tract is formed, what the tract does. And neuroanatomy, once you understand that, it becomes very, very logical because we are going to be following these tracts throughout. The ascending, we'll see how it is traveling through the brainstem. So, we have started at the spinal cord and we are going to go up. And for the descending tracts, we started at the spinal cord, so we saw its presence in the spinal cord, but as we go up, we'll see how it is originating, and when we reach the cerebral cortex, we'll finally kind of complete the puzzle for the descending tracts.